Hello everyone, I am Dr. Prachi Kulkarni, Fertility Specialist, Ferty9 Fertility Center, Banjara Hills. Today I am going to talk about a question which is commonly asked as a fertility specialist to me. Patients usually ask, doctors, I have regular cycle, we have done a follicular study or the ovulation monitoring scans and it has been shown that I have ovulated but still I am not able to conceive. So why is that so? So this question is simple, despite of ovulation, why you are not conceiving? But this simple question has an answer in many things. So what first we have to understand is ovulation is not the only factor which will help you become pregnant. So first and most important thing is visit a proper fertility specialist, get both of your tests done as a couple at the same time, like your blood test, your sonography, your husband's semen test, husband's blood test. Once that complete fertility evaluation is there, you will have the reason for your infertility issue. And after understanding the issue from the doctor, if the doctor has advised you to undergo ovulation induction with timed intercourse, which is like monitoring or documenting your ovulation on scans and having natural intercourse at home to conceive, is called OITI cycle. So if you are undergoing an OITI cycle, what we document on the scan is you are developing an egg, that egg is being released properly and your uterine lining thickness is grown properly, the 3D cavity of the uterus is normal, there is no any polyp, then the doctor advises you to have regular intercourse around the time of ovulation. So what could have gone wrong in a OITI cycle? So the factors can be multiple. Suppose the factor is in the semen factor. That is one reason. Second could be any reason in your tubes. Third could be any reason in your uterus. Fourth could be immunological, genetic cause or any other medical condition which may also affect fertility. So now we'll go step by step. So first factor, which is a semen factor, where we have to see if the sperm count is normal, that is above 15 million. Then we have to see if the motility is good, that is above 30%, and the morphology of the sperms is good, more than or equal to 4%. So if you have, your husband has less sperm count, like less than 15 million, or the motility grade 3, grade 4 together is less than 30%, then you may have problem conceiving naturally. So in that case, your husband will also need further evaluation and treatment from andrologist, and that should help. So then second cause is tubal factor. So if you have not evaluated how your tubes are, then you should get evaluated for your fallopian tubes for they being open and they are not blocked, or there is no any hydrosalpinx or the fluid accumulation in the tube. Also, when we see an HSG film, if the tubes are open, we cannot definitively say that they are functional. But at least open or patent fallopian tube is a requirement when you are trying to conceive naturally. Then coming to the third factor, which is a uterine factor. So in the uterus, what is important is your lining thickness should be growing according to your period day. So this thickness between 8 to 12 mm around the time of ovulation is considered good lining. So this lining thickness, if it is developing, then you should have good chances. Also, what we see on ultrasound in the uterus is if there is any presence of uterine fibroids, especially submucous fibroids which are going inside the cavity, or presence of any endometrial polyp which is present in the body of the uterus or near the fundal area of the uterus where implantation happens. So if any such thing is present, then they require surgical removal. Otherwise, the implantation will not happen. So submucous fibroid and endometrial polyp can be the reasons which should be picked up on the ultrasound. So this is about the uterine factor. The other uterine factors also may be if you have septate uterus, or if you have bicornuate uterus, or if you have intrauterine adhesions which are Asherman syndrome, where the lining of the uterus doesn't grow properly and it stick together, then also you will have problem in conceiving. So if any such problems are present, they will require surgical correction. So this is about the uterine factors. Then coming to the immunological, genetic factors or other medical conditions. So immunological factors, somebody who has SLE or rheumatoid arthritis, or even sometimes thyroid disease, where there is a presence of autoantibodies in the blood, may have problems in conceiving naturally. Also, some genetic factors, like if you are having any problem in your karyotype, like translocations, then also there might be a problem in conceiving naturally. So other medical conditions which are like diabetes, blood pressure, thyroid also should be under control when you are trying to conceive naturally. So overall what we saw is maybe some factor in the semen parameter, some factors in your tube or uterus, or immunological or genetic factor, and medical conditions. So not just simple ovulation will make you pregnant. All these factors needs to be ruled out or treated. If they are present, then you can conceive. So also when you are trying to conceive naturally, make sure that you have regular sexual intercourse at least 2 to 3 times a week, irrespective of your period day. Because usually when we advise couples to have intercourse around the time of ovulation, that creates performance anxiety on the male partner, and most of the times it may not happen when it is required. So as a regular basis, if you have that practice of having regular sexual intercourse, then that should also help. Now coming to the end, if after trying naturally for 2 years at home, or after undergoing the ovulation induction cycles at least 3-4 times, if you're not still conceived, then better you get evaluated from a fertility specialist properly and move ahead in your treatment ladder. You may consider going for IUI, or if required IVF, because female's age is the most important factor when it comes to conceiving. So all the best for your fertility journey, and I hope this was helpful. For any further queries, you can contact us at Ferty9 Fertility Center. Thank you so much.